Somebody has asked me before, where does the blood come from during coccidiosis? Where is the blood coming from? Where is that brownish diarrhea? That brownish is blood. We first have to agree to that. But remember, our bodies are complete in terms of there is nowhere where there is strong blood coming out into the body systems. So where is that blood coming out from? Ulcerations. So the more blood you see, the more ulceration. The more ulceration, the lesser the feed absorption. That is of great importance. Coccidia in poultry are generally host-specific, and different species infect specific portions of the intestine. Again, that's a very important point. Different Eimeria species affect specific sites. Eimeria cerevisiae will affect a specific part of the small intestine. Eimeria necatrix will affect a specific part of the small intestine. Eimeria necatrix will affect a specific site in the small intestine. They are site specific. So it's not in general, whereby whenever you see a chicken affected, you look at it, you do a post, this is Eimeria necatrix, this is Eimeria necatrix, this is Eimeria cerevisiae. So they are actually site specific. Coccidiosis occurs in South America. It is ubiquitous. It is everywhere. Coccidiosis are almost universally present in poultry ranging operations, but clinical signs only occur upon ingestion of large numbers of sporulated oocysts. What we are trying to say is that the oocysts will be available in the environment, the oocysts will be available in the poultry house and its surrounding. But the only infective time is when there is sporulation of the oocyst. I hope that is well understood. So you can be able to say we have oocysts here. The question is, are they infective? And they only become infective upon sporulation. And sporulation is something to do with oxygen, moisture, and warmth. These are normal things, especially in our country. The humidity, anywhere you can get moisture, oxygen is available everywhere. And this kind of humidity is very conducive for coccidiosis to become infective. So we have the oocyst, we have sporulation, and we have infective. It must be infective for it to cause disease. Both clinically infected and recovered birds shed oocyst eggs in their feces. But remember, we have said only infective. After sporulation is when it becomes infective. So they will shed the oocyst eggs, but the question is whether they have become infective. And they shed this with contaminated feed, dust, and water. Oocysts may be transmitted through equipment, personnel, through shoes, presence of insects. We have talked about this when we were discussing Musca domestica. Flies will actually transmit and spread oocyst eggs, whether infected or not, and this will lead to transmission. Then we are going to have rodents. Anywhere you have rats, anywhere you have anything moving around in the homesteads, you will actually be able to have contamination of coccidiosis. This is of importance because the large farms, the extensive large farms, when you go there, when they call you as the expert, they always, most of the time, have tried everything. So you'll go there, you'll tell them this is coccidiosis, you all agree this is coccidiosis. The question they will ask you, where is it coming from? Yes, umenisaidia na dawa. Yes, umeniambia nifanye nini. Remember, I have done everything you have told me. And that is why you have to go there. Don't be in a box. Think widely. Check around. Check whether they are controlling rats. Check whether they are controlling flies. Check whether when they do their fumigation and when they do their disinfection, whether they are doing to the T. Is it being done very well? Because you'll realize that they'll keep telling you, we have that house, we have this house, we have this house. As long as you're having a spread of coccidiosis from two different houses, you need to be able to establish who is spreading it. Otherwise, you will keep keeping them on treatment for so long, and that will not be helpful for them. So ensure that you keep checking whether we have rodents, ensure you keep checking whether we actually have flies in the neighborhood. Ensure that, as you say, disinfect everywhere. If it's possible, supervise. It is very easy for the small scale farmers in a room like this for them to do efficient disinfection. It is very hard for a large scale farmer to ensure disinfection has been done from this corner to the other corner in a farm that has 10,000 birds. Do you know that? And the workers will always lie. They will say, ulinipea chupa 10, nimetumia zote zimeisha, so disinfect. But as they disinfect, what happens? They get tired. And they realize the most important thing to prove they have done it is to finish the disinfectants. Yes, we have seen this happen in different farms. Because for them, they don't know why they are doing this. It's a bother. Apart from them collecting eggs and slaughtering the broilers once they are due, these other things they do not understand so much what they are doing. And so they will realize, umenipea chupa 6, natumia hadi ziishe. So they just stand here and they will spray and they will spray. And when they get tired, they'll say, we actually sprayed the whole house. Always ensure that is done. And on that note, as you can see, for rodent control, we have something called rod reed. How many of you have used rod reed? So many. But there's always a bother. There's always that question that you have been asking about the block, because we always ask you to crack the block before you put it in a bait trap so that it can kill the rats. And everybody was actually saying, can we have some pellets? Can we have some pellets? We have had you, I think, in the next quarter starts on 1st. In the next quarter, we are going now to have rod reed pellets, and you will not have to crush it. Simpige nduru. Mngekuwa ni politician mngepiga nduru, si ndio? At least tumewasikia. So we are going to have rod reed pellets, especially for in-house. We will still keep the block, especially for outside use, because the block and that works. Most of you don't know why we have the block, because when we are doing bait traps outside, it's very hard to do with pellets. So we'll still keep the block, but now we are going to have pellets for the in-house. Anyway, moving on, fresh oocysts are not infective until they sporulate. That is the message I was driving. Fresh oocysts are not infective. The chicken might shed the oocyst eggs, but they are not infective until they sporulate. Under optimal conditions of 21 to 32 degrees, adequate moisture and oxygen. And the sporulation takes place within 1 to 2 days. The prepatent period is 4 to 7 days. Sporulated oocysts may survive for long periods in the environment depending on the environmental factors. What that point says is that whenever you have coccidiosis, there's a chance that the coccidiosis can stay in that environment for a very long period, into years. And that is why it is very important to ensure that when you control it, you manage it, you have to do it very well. Oocysts are resistant to some disinfectants and commonly used around livestock. And this is just to try to say that as much as we might use the common disinfectants, some of them may not actually be able to penetrate the oocyst eggs, especially when it is still not infective. And that is why they just leave them there until they sporulate, and that is the time that they might actually be able to control the oocyst egg. Pathogenicity is influenced by host genetics, nutrition, age of the host, concurrent disease, and species of the coccidia. This tells you that genetic makeup of a bird has a part to play in how the coccidiosis will actually be able to reveal itself. This tells you that nutrition of a bird has a part to play when it comes to coccidiosis. Age of the host. Very, very, very small chicks are very naive. The immunity is not that good, so you will actually see the small birds showing extreme clinical signs as compared to elder birds. You'll actually be able to see some birds that are big, maybe they are almost at slaughter. You test the fecal matter, it shows that there is oocyst, it shows that there is coccidia, but the birds are not showing the clinical signs. But if that is exposed to the day-old chicks, or maybe 1 week-old chicks, because of the naivety of the immunity, these birds will actually be able to show the disease. Concurrent disease. A very high chance that whenever you have other diseases, you have stress factors, then the birds might actually come up with or come down with the disease. And it's very important also to watch the species of the coccidia. We have talked about predilection sites of the intestines and the specificity of the Eimeria to a certain predilection site. And this is what we were talking about. The Eimeria tenella will only affect the ceca. The Eimeria necatrix will affect the jejunum. The Eimeria acebulina will affect the duodenum, and then we have the Brunetti going in the ileum and the colon. So whenever you do a postmortem, you see that loop, you should be able to show where the duodenum is, jejunum, the ileum, and the ceca, and based on this, then you can be able to tell exactly which Eimeria is actually affecting those birds in that flock. Diagrammatically, I think we can appreciate down there how it looks. As you can see, portion of the intestine where the lesions are mostly seen. For Sevulina is at the top there, and you can see it's the duodenum, the beginning part of the small intestine. When it comes to the maxima, as you can see, it is the jejunum, and then when it comes to the brunette is in the ileum and the colon, and then we have tenella being in the blind spots, which is actually the sicca. And that is actually how it appears. You might get some mixed infections once or twice, but basically that is where you'll find most of the lesions after opening up the bud. Then the life cycle of coccidiosis. I know this one we do not like getting into it so many times, but it's quite interesting for us to understand exactly how coccidiosis develops in a chicken. And as you can see that bud there, the first bit is ingestion of sporulated oocysts. If there is no sporulation, there is no infection. So sporulation must happen to the oocyst. And then what we'll see there is that the bird is going to, as it feeds, as it goes around its business, based on curiosity, it will actually peck on some oocysts which are sporulated, and it will ingest that oocyst. This oocyst, most of the time, will actually be 4 in number in one sporulated oocyst. And when they get in, they are right here, 4 of them together. They are now infective, and then the bird will consume, and that's where you can see A. Then after A, now we get into the sporulated oocysts, which are 4, will actually get into the crop. The crop has acidity. That acidity is actually what is going to unenvelope it. And when it envelopes it, then the schizons will get into the intestines. And when they get there, that's when now destruction starts. And what happens is that the sporozoites will penetrate the endothelium, the intestinal lining. Inside the intestines there is a lining, and there are cells there. And what happens is that the sporozoites will get in there, penetrate in, multiply within the epithelial cells of the intestines, and as they multiply in there, they become more, and what happens is that the epithelial cells of the intestines will burst. Basically what I'm talking about is this. There, the sporulated oocyst is here. I've told you they are now 4 in number. When they get into the intestines, the acidity of the stomach will actually envelop this, and they burst out. And when they burst out, they become sporozoids. Then these sporozoids now penetrate the epithelium or the epithelium lining of the intestines. And when they get in, they keep multiplying. And what happens is after multiplication, they burst open. When they burst open, what are they leaving? What are they leaving? And ulceration is coming from. Once they multiply, and they are very many, imagine this is an epithelial cell, and this is the lumen, this is where the food is, this is the intestine. When this bursts, as these sporozoids come out, what is left here is a lesion. So there's an ulcer there. There's a wound that is left here. And once they come out, the sporozoids penetrate other epithelial cells, and they multiply, and they burst out again. Remember now the destruction of the intestines. That is why there is massive damage, because there is no absorption sites. The microvilli are destroyed, the villi are destroyed, and then what happens is that once they come out for the first asexual reproduction, they penetrate the epithelium cells again, and they burst out again for the second time, meaning that there is total destruction of the epithelium. And after that happens, what you have now is the production of the 2 micro and macro gametes. And when we have the micro and the macro gametes, then these ones will fuse together to form a zygote, and then the zygote is what comes out as an oocyst. And you can see now we have the sporozoid here after bursting. Then we have the sexual reproduction. There are 2 kinds of reproduction that happens in protozoa: asexual reproduction and sexual reproduction. But in the chicken, the Eimeria has 2 asexual reproductions for total destruction. 2 asexual reproduction before 1 sexual reproduction. Because in sexual reproduction is whereby we have the microgamete, which is the male, and the macrogamete now, which is the female. Then these 2 will fuse together, and they will form a zygote, and that zygote becomes the oocyst eggs, which is now laid out. of the body. And now it comes out as feces. After it has come out as feces, sporulation happens again, and the whole cycle starts again. I know we work in agrovets. Whenever we have a customer, rather a farmer, let's not call them a farmer, a customer, let's call them a farmer. Whenever we have a farmer who has 1,000 birds and comes in with a problem of coccidiosis, we know we are set. We are set for a full season. Full season. Actually, when you go to church, you have to say hi to them because you know they are coming. It's just a matter of 7 days because of that. It just goes round, comes again, sporulates, again it eats, epithelial lining destruction, it comes out, it comes back. And whenever you give them medication, it's not that the medication is not working. The problem is this cycle. Because if you treat this bad, first thing, let's note, you have not treated this ulceration. Sindio, it takes so much time to heal. But as you treat this bad in terms of the protozoa and the Eimeria, the feces is still coming out with oocyst eggs. So as this bad tries to heal, there is sporulation of the oocyst eggs. Guess who eats the feces again? The bad. So it's just 1 week. And they come back, and they come back, and they come back, and they keep complaining. And that is why whenever you are dealing with coccidiosis, kindly do an integrated treatment of coccidiosis. Treat the bad, treat the environment. Try to ask the farmer, where could we be getting this infection from? Because if you can block that, that is the only time you have helped the farmer. Otherwise, they are going to be on coccidia, anti-coccidia for the longest time. And they will not have the birds get to full potential. So do thorough disinfection, do some treatment towards the regeneration of that epithelium. Focus on the regeneration of the epithelium because there is no absorption without the microvilli and the villi. So if you are doing supportive medicine, ensure that it can actually be able to close those ulcerations. So tuko na ulcers. Lakini siku hizi tunaenda kwa clinic tunaambiwa ni H. pylori kit. Nani ako na H. pylori kit? Mzee uko naye? But mnakuwa diagnosed kwa chemist. Is it possible to diagnose somebody and tell them your Echinobacter is above? You know, Echinobacter is just a normal bacteria within our systems. Is it possible to diagnose it by looking at you and clinical signs? How do you determine that the Echinobacter is actually above the H. pylori? Because it's a bacterium which stays in our gut. The only time you have an issue with it is when it has surpassed, it has proliferated. You are stressed and all that, and it has proliferated through the roof. How can you diagnose that situation? Yes. It is only through a stool sample. Hakuna njia ingine. Ati nikuangalie hivi nikwambie. Unahitaji H. pylori kit. Tuache hiyo mchezo. You must take a stool sample for you to actually be able to say the normal level of H. pylori in your body should be 10 parts per million. But now you have 1,000 parts per million. We need to do what? We need to treat it. Lakini H. pylori kit zimeuzwa. It's the new business at the chemist. Anyway, back to coccidiosis. That is where the problem is. So ensure that you can treat that ulceration in the bud and ensure that that acidity does not get in because it is causing pain and it is causing less feed absorption, and that is what is making the bud not gain weight and making the farmer not gain profitability. What are the clinical signs of coccidiosis? The first one is diarrhea, often blood, watery, mucus diarrhea, behavioral changes, lethargy, depression, huddling together, droopy wings. The broiler birds' wings are drooped, the birds are looking sickish, the birds are looking lethargic, there's some level of depression, ruffled feathers, pale, shriveled combs and wattles, performance decline. This is very important. Drastic reduction in appetite and water intake, leading to weight loss and poor growth. Then the most important clinical sign that the farmer will bring to you is high mortality. High mortality. If there is massive invasion, if there is massive asexual reproduction, there is a probability that the bird will actually be able to die within a day or so, and there will be a lot of mortality, especially in the second and the third week of the broilers when the birds are still young and the immunity is not functioning very well. Then upon post-mortem lesions, we have discussed this intestinal damage, thickened intestinal walls, significant, sometimes fatal hemorrhage in the intestines up to the seeker. If we have thickening of the intestines, again, back to my point of poor feed conversion, poor feed gain, and that is the problem we are having. Reduced production, drop in egg production, and weight gain. In terms of an illustration, I think, who has not seen this picture in a farm somewhere? This is very common. We have probably all seen this. As you can see, this is frank blood, brownish diarrhea. You can see a lot of air-filled diarrhea. You can see that bird there at the end. The ruffled air feathers, the handling, it is really trying as much as possible to have the sick bird syndrome. That is the sick bird syndrome. But you can see down there is a lot of blood coming together with the excreta. So these are the clinical signs to watch for. Then pathologically, this is what is happening. And I want you to think of this whenever a farmer talks to you about coccidiosis. Just know there's a lot of hemorrhage, there's a lot of thickening of the intestines. This is a savulina. And I wish you could appreciate this. This is what is happening. Do you think there's absorption going on when that is what is in the intestines? Is there absorption? There is no absorption. There is no absorption at all if that is what is going on. Look at the thickening of the intestines. There is no microvilli here, there is no villi here. And without the microvilli and the villi, again, we lack the state of absorption, and the tight junctions are broken, and everything is just penetrating into the bloodstream, and then you end up with a very watery poop, and the bird looking very sick. Then as you appreciate that is a state of how the birds should actually look, healthy birds. Here, what I want you to look at is actually the litter. How is that litter? How is that litter? There's nothing wrong with it, so don't overthink. You know, the current problem we are having is overthinkers. Somebody asks you, what are you looking at? And you start looking inside your head. There's nothing to think too much about. Can you look at this excreta? This is how the feces should look like. That is how the litter of birds should look like. The farmers who attend to, what is the biggest challenge they are having with litter? What are they saying? Yes? And all that. So tumekubali hakuna roof leakage. Apart from the bird, apart from the litter that you put there, what is coming into the litter? The excreta. Sindio? The excreta is coming from the bird. So we are having a problem with the GIT of the bird. Treat the bird, not the litter. Of course, remove the litter, but if you want to stop that continuity, treat what? The bird. If you ate something bad today, and I think everybody now is seated and we are good. If we were given something that is slightly not good to the taste of the stomach, what would happen? The body mechanism will ensure that we throw it out, and we will all be rushing to the... Is the solution getting more toilets so that we can all have a toilet to sit in? That is what you are doing by telling the farmer, remove the litter and put fresh litter. We are having a lot of problem and lack of focus on the GIT. Focus with the GIT, check what the farmer is feeding the chicken, check what is coming out. Ask yourself, why are we having such watery feces coming out? See what you can add in terms of supplementation to ensure there is no watery feces, to ensure this is how the litter looks like. These birds are 14 months, not 14, 15 months, and that litter has never been changed. That feces is very dry. You can appreciate the whitish, which is the raw uric acid, and that is how the feces looks like. That farmer does not need to change their litter. Not today, not tomorrow, not in the year. Because you can see the litter is in particles and it is very dry. Can we ensure we go back and check what is happening with the bird as we tell the farmer, toa wood shavings to lete zingine? The only people we are giving business are the carpenters. Right now hakuna carpenter anaacha wood shavings nje. Kitambo silikuwa inaachwa nje. These days inafungiwa hata kuliko mbao yenyewe. Because there is more business on the wood shavings than the wood. Why? Because we are not treating the problem. If your farmer has ammonia in their chicken, the ammonia is coming from the chicken. If your farmer has wettish litter, dampening litter, it is coming from the chicken. See what you can do around the chicken, because that is where the problem is. Otherwise, That is how a healthy intestine should look like. I want you to appreciate, even when you cut it, it actually turns on itself. The pinkish, I wish you could see it here. This is how healthy looks like. Is this excreta going to be wettish on the wood shavings? Yeah? That's a healthy bird. That is how we want our birds to be. And if we have this healthy bird in terms of the intestines, there is going to be absorption. Here, if we were to look at a microscope, we'll probably see the longitudinal view, and I can tell you these are the villi that we need to be as healthy as possible. And that is the only time when the people who give you day-old chicks and tell you the promise is in 5 weeks this bird is going to be 1.5 kgs, in 5 weeks this bird is going to be 2 kgs, will only happen if that is the state of the internal organs and the digestive system. How do you diagnose coccidiosis? How will you know confirmatory that there is coccidiosis? The first one is easy, it is fecal flotation. This one you use saturated chlorides like sodium chloride. You just need to put in a little bit of the feces in there and keep stirring and keep stirring. You will end up with the oocyst eggs coming on top, and then you can be able to view that under a microscope. It is 80% accurate. We still have some 20% remaining. That means even if it is negative, there's a chance it could be positive. But if it is positive, it is positive. This is very easy to do. Then we have the histopathology, examination of the tissue samples collected at necropsy. Then diagnosis is based on the location of the lesions, host, and their appearance, and the size of the oocyst eggs. Coccidio infection are readily confirmed by demonstration of oocyst in feces or intestinal scrapings. I think we have talked about that. And then the severity is what will determine the cause, the best course of action to treat. Comparison of the lesions and other clinical signs allows a reasonable, accurate differentiation of coccidio species. So knowing the lesions on the pathology and seeing the severity of the disease can guide you towards knowing, is it acebulina, is it tenella, is it maxima. A diagnosis of clinical coccidiosis is warranted if oocysts, merozoids or schizones are seen microscopically if the lesions are severe. So we are going to see either the merozoids, the schizones microscopically, but the one thing that you can be able to appreciate will be the oocyst eggs. We have a lab around this place, a government lab. Iko wapi? Nani hakuwa anajua iko Mariakani? Asante. Kuna mmoja hakuwa anajua. Nani amepeleka sample Mariakani? Who has ever taken a sample to Mariakani? Asante. 2, 3. Out of 200 of us. Are we 200? Only 3 of us have taken samples. So I told you we have a gap on diagnosis. Do you know how much it is to take a sample there and get your feedback? Also, these days they have digitalized. You can send the sample, they will send the results via email. You don't need to go back there again. So as you treat this bird, a farmer has 10,000 birds, and you cannot spend 200. 200 kutuma sample, ukiendelea na kutibu, it's called a shot in the dark. Have you done AI in sheep? It's called a shot in the dark. You're not sure what you are doing. So as you treat the birds, the clinical signs are pointing towards coccidiosis. But how many of us are willing to take a sample, lock it in, eka kwa gari, wacha ipeleke Mariakani? The total cost is 200. And then get a confirmatory diagnosis, rudi kwa huyo mkulima umwambie ukiringa, nilikuambia ni coccidius ndio hii. You see, it will be very clear there. And then you can be able to see whether we have what? Worms. And then now you can go back and tell the farmer, we need to deworm your chicken. Because the results show you have this challenge. Can we start appreciating these labs? Because they are very, very helpful. When you have a case of ECF, take a sample. If you continue doing your treatment, before doing your treatment, just take a sample. Store it well, send it there. It is not that costly. We can actually be able to end up with good diagnosis, good database. When we were discussing this coccidiosis, we tried to get some data from the vet labs, and it becomes very difficult because I think the vet lab in Nakuru, they have only been able to register less than 200 cases in the whole quarter. Is that a reflection of the society in terms of coccidiosis in that area? No. But we're supposed to send the samples there. Finishes. My point is, let's try as much as we can do to ensure that we can send some samples there so that they can work on it, so that we can have a better representation when we are discussing these diseases. Then coccidiosis management, use of anticoccidial compounds in feed or water. Then vaccination. There are 3 ways of managing coccidiosis. One is the use of anticoccidial products in feed, the other one is use of anticoccidial products in water, and the third one is through vaccination, or a combination of both to prevent clinical signs. Once clinical signs appear, use of antibiotics and supportive care is advisable to minimize dehydration and secondary bacterial infection. Anytime that ulcer forms, what else happens? We have pathogenic bacteria within our gut, and they are just looking for any way to penetrate in. So whenever the sporozoids burst out of the epithelial lining, then there is direct access into the bloodstream. And what happens with the pathogenic bacteria, Clostridium and the rest, they will actually be able to, the Pasteurella, they get into that site and they lead to secondary bacterial infections. Now you are dealing with 2 problems, sometimes 3 problems, just because of coccidiosis. The first treatment, management of coccidiosis is vaccination. Commercial vaccines consist of live sporulated oocysts of various coccidio species administered at low doses. So vaccination, what is vaccination? It is inoculation of the molecule, but it is not as harmful as it is when it is alive. So again, vaccination of coccidiosis is nothing new, just the normal thing that you know. Is only that now we are injecting what? Sporulated, that is the word, sporulated oocysts into the chicken, so that now the chicken can cause a reaction, a physiological reaction, and then it creates antibodies. It's just the normal way we do with the other vaccines of Newcastle, of Gumboro, and the rest. Most commercial vaccines contain live oocysts of coccidia that are not attenuated. They are not attenuated, and that means they are alive and they are raw. The sporulated oocysts are raw. The self-limiting nature of coccidiosis is used as a form of attenuation for some vaccines. I don't think we have this vaccine in the country. I do know there are other countries, especially in Europe, that vaccinate their broiler birds and their layer birds, but in Kenya, we are yet to go in this direction. I think it's something that is going to happen very soon, because that is a gap that is there. The question will always be the viability, the balance between the vaccine and the profitability. But I know this is a direction that we might take very soon, and maybe we'll find one of these pharmaceutical companies coming up with the vaccine for coccidiosis. Let's hope it will be economical and we can actually be able to use it, because it can really help the farmers. The second way of controlling and managing coccidiosis is by use of anticoccidial drugs. And this is where we have so many drugs that have come in. We have amprolium, we have clopidogrel, we have folic acid and the sulfurs. I think this is the most common we have in the market, the folic acid antagonists. This is where we have the sulfur, the trimethoprim. This is where we have, what do we call them? Sulfaclozines and all those other products that we have. Then we have now what we call the ionophores. This is the monensin, salinomycin, narasin, and the securamycin. This is basically what we use in the feeds, especially the broiler feed that we like so much. Imeandikwa nini hapo juu kwa gunia? With what? With? Yes, with coccidiostat. Most of the time it is the ionophores that they are put into the feed, and majorly you'll find it is an issue of monensin, salinomycin, and nicabazine. That is what is available in the country. That is what they call the coccidiostat that you find especially in the starter feeds. In the starter feed majorly. Yeah, that's what they have put there just for protection and prevention of your birds. Nicabazine is toxic for layers, causing mottling of eggs and decreased egg production. So take note, nicabazine. Everything you see that has nicabazine is actually toxic to layer birds. I know we do have a nicabazine in the market. It is clearly stated for use in broilers. But somebody was telling me, kwani nini itafanyika kwa layers? Sini kuku. There's a reason that the pharmaceutical companies will always write these things. Tafadhali, we have anicabazine in the market, do not use it for layers because it's actually toxic and we end up with a lot of problems. The farmer will start wondering, why do I have decreased egg production? Why are my eggs blanching? You know blanching? When the egg is slightly different from the rest, and then there is brownish, a different kind of brown on the eggs. And probably the market will not be able to accept this. And again, the residual effect of that nicabazine in the eggs, if we consume it, is going to be a big challenge. Then we have robetidine, and then what you need to note, as far as this is concerned, is the fact that drug resistance may develop during use. And this is what we are having currently. We are we are actually able to clinically diagnose coccidiosis. We are treating, it is coming back, we are treating, it is coming back, and majorly is because of the overuse of this product. And that is where the problem is, because we need to either manage the birds before they get the infection, or find another way, or find another new molecule. And coming up with new molecules is not that easy. If you work that can be taken through AMR and microbial resistance and know how we come up with a new molecule, I can tell you, you are going to protect the few molecules that we have in the market, because it's a long, lengthy process. And actually, nobody wants to go in that direction anymore, because there is no longer money, there is no money these days into coming up with a new molecule, because the research takes so much. The research and development team consumes so much money just to be able to come up with one molecule. The problem is, they are saying, after we come up with this one new molecule, within 5 to 10 years, it's already resistance. So you are not using it again. Do you think we will get the money we use in research and development? And slowly by slowly, more companies are saying we are not going to get into research and development. We need to use these products very well. We need to manage coccidiosis by ensuring that the birds are not getting sick. And if they get sick, we have to ensure that we do the right treatment. Actually, now what we are getting into is the combinations. You'll hear somebody say, I have a new coccidiosis product, but what they have done is combined an aproleum and a folic acid. What they have done is combined an nicabazine and a naracin. And whenever you hear combinations, you know tumefika mwisho. Where else are we having combinations? Acaricide. Umepata acaricide mpya kweli? Sini story tu mnatupea. We are purely on organophosphate, synthetic pyrethroid, and amitraz. And because we have no new one, then our synthetic pyrethroid plus organophosphate is a new molecule. Is it a new molecule? Then kidogo kidogo, another combination. Na ngoja mtu sasa achanganye amitraz, OP na SP. That will be the newest, because amechanganya tatu. Anyway, you get the point, and you get what I'm trying to say. Whenever we get into combinations, we know we are getting to the end, and we have to accept. Anticoccidial resistance is here, antimicrobial resistance is here. What more can we do to ensure that the products that we have are actually beneficial? This is just, I like using diagrams, they are easier for us to understand. As you can see here, this is basically what we were talking about, extracellular, intracellular. Sporocyst with 4 gets into the endothelial lining, sporozoids come out. This is the first asexual reproduction, and then it gets back as schizons, and then we have the merozoids bursting again. Merozoids 1 get back into the endothelial lining, burst again. This is the second asexual reproduction, build up of immunity, male gametocyte, female gametocyte, oocyst. I think this simplifies the life cycle. Cindy, and I want you to appreciate that there is the first asexual reproduction, which causes damage. Then there is the second asexual reproduction, which causes more damage. Before then, we have the sexual reproduction. These are all the anticoccidials we have in the market. And I can tell you, the one that now we are saying is the best, it is this combination. Naracin plus nicabazine. That is the new coccidiosis that now we are putting in the food. And why we are putting it there is because it is a combination. And that is why it is highlighted in red, because it works very well. But otherwise, the rest are there and they still work, but we need to use them sparingly, probably do sampling and be able to treat. Anticoccidial drug challenges in treatment of coccidiosis. Continuous use of anticoccidial drugs promotes the emergence of drug-resistant strains of coccidia. Then various programs are used in attempts to slow or stop selection of resistance. For instance, producers may use one anticoccidio continuously through successive flocks, change to alternative. That is what the large farms are doing. The large farms want to be very clear what coccidiostat is in the feed. Then they will use that maybe for 1 year. Then they will say, can we now change to narasin? They use that for 1 year. Can we change now to nicarbazine? In just a management issue to manage coccidiosis. Widespread resistance to most drugs has been registered. Anticoccidio drugs have a very long residual effect. The withdrawal period of any coccidio drug is quite long. That is why you see we put the nicarbazine, narasin, salinomycin, monensin in the chick start. We are not putting it in the finisher. Do you know why? It's not that we don't want to. It's because of the withdrawal period. But you see now in the last stages, that is when we have even more coccidiosis. And that is where now we come in and we start using the anticoccidio. So the first 2 weeks, the first 3 weeks, the chicks were on what? Ionophos. Then the last 2 weeks, they are on what? Sulfurs. Do you think they will grow to the promised weight if they are always on drugs? So that is the challenge, and we need to be able to sort that one out. Then again, as Atlantis, we have been able to get into that gap, see how best we can help, and then we have come up with something called organic anticoccidia. We are going herbal. We are going towards the olden way of doing things. Nani nyanyake alikuwa anafanya ile vitu za mitishamba? Wenye wametoka huko kwetu. Mitishamba was something that was very common. We were respected because of that. You know, my grandmother was a doctor. People used to come to our home to drink some concoctions there. And I don't know what they were drinking. And then she would disappear one evening. Because she did not want anybody to know what she was going to get from the forest. And then in the morning she would come with a gunia with so many herbs. And then she would say, hii ni ya sijui nini, hii ni ya nini. I don't know how effective they were, but we got some good money out of it. My point being, these herbs, it's true, they do have medicinal value. These herbs do improve our immunity. The question is that we are lacking people who want to research them. We are lacking people who can be able to tell us what this herb does and how it can help us. But other countries have been able to do that. They have put a lot of money in the research and development of these herbs, especially India. I think even now, every time we talk about sickness treatment, everybody is talking about India. And when you go there, there is so much input towards their traditional way of doing things. And they are talking about herbs and herbs and herbs and herbs in everything they do. So we have organic anticoccidia. It's called BIOCOX, 0 withdrawal period. The best thing about it is the immunomodulation, prevention of secondary bacterial infection, prevention of coccidiosis, and the one important thing is the prevention against necrotic enteritis. And the last bit is about the repair and maintenance of damaged epithelial cells. So it will actually help to repair the damaged epithelial cells. It will actually prevent necrotic enteritis. Who knows necrotic enteritis? There's a research paper we got from Kwani University on necrotic enteritis. It says all the broiler chicken in Kilifi and its environs have necrotic enteritis. Who has seen that paper? Who have heard about it? Why are the broiler birds dying around Kilifi and its environs? Hata hamjasikia. Mimi naja niwaambie vitu hamjasikia. So there's a challenge. Necrotic enteritis is a very big problem that is there, and it is connected majorly with hatcheries and so on. And whenever we have coccidiosis, the rate of necrotic enteritis happening are almost 90 to 100%. It is a silent disease in such that everybody focuses on the coccidiosis and forgets anything to do with necrotic enteritis, which is actually caused by Clostridium perfringens. Clostridium perfringens stays within the intestine, does not cause any problems until there is ulceration. Then it penetrates in there, and that is how you end up with a necrotic enteritis. And if you have inflammation of the intestines and thickening of the intestines, I have told you there will be no absorption. Birds with necrotic enteritis die. The mortality is so high, up to 90%, in less than 2 to 3 days, especially the young birds. So you might actually be thinking you are dealing with necrotic enteritis, with coccidiosis, when you are dealing with necrotic enteritis. And that is where now the problem comes in. What do we have in this product? I have told you, and I think from today we have agreed, if you want to understand the product, go to the back side. Tumekubaliana hivyo madaktari? Read the composition. Let's stop the stories of sijui booster, sijui inafanya, sijui. Read what? Read the composition. Because we are having a lot of these names, good names that are being used. But when you go on the back side, you realize that the composition, the ingredients in that product are not able to do what has been promised. Kindly, let us study composition of a product. One of these is this side, and you can see we have a dark brown colored liquid comprising of unique special herbal extract. Then we have FOS, then we have MOS, and then we have vitamin A and vitamin K. The bleeding needs to be stopped. So we need a clotting factor. What is the clotting factor? Vitamin K. Hiyo imefanya kazi yake. The epithelial lining needs to be able to repair and be regenerative. That is the work of vitamin A. So the immunity of the birds need to be repaired as fast as possible by making sure that we have immunoglobulin M, immunoglobulin G, and that can only happen through MOS and FOS. And then away from all that, we need now to be able to treat the sporulated oocyst, the schizoid, and the merozoid. Then we are able to have a complete control of the Eimeria species. And you can see here we have the MOS, which will reduce the schizoid and the oocyst count. Why we want to kill the oocyst is to ensure that when it goes out, there is no sporulation. So we are trying to stop that replication. So by killing the oocyst, we are sure that there will be no another cycle of coccidiosis. Then we have phytochemicals. Right now, I want you to read about phytochemicals. I want you to read about something called flavonoids. I want you to read about something called saponins. These are herbs that are of great benefit to the animals and to us. And all the research right now around treatment is happening around those herbal extracts, especially the flavonoids, the phytochemicals, the saponins. That is what is contained in this product, the alkaloids. And they are naturally occurring. And if they are naturally occurring, they are not going to affect the homeostasis of the animal. And there will be continuous production. Then now we have the vitamin K, which will avoid the hemorrhage, and vitamin A, which helps with the regeneration of the epithelium. I was talking about necrotic enteritis, so I tried to pick a little bit of it. And BIOCOX is able to treat and prevent both coccidiosis and necrotic enteritis. And as I have said, necrotic enteritis is acute enterotoxemia, meaning very fast death. Acute enterotoxemia by an anaerobic bacteria known as Clostridium perfringens. This heteroxemia will lead to very fast death of the very young birds. And this is a big problem. And as I've said, go and find out more about that paper from one of the lecturers in Pwani University. He did some sampling of almost 20 farms, and they all came back positive through the Mariakani labs on Clostridium perfringens, a confirmation of the birds were not dying from coccidiosis, the birds were dying from necrotic enteritis. The clinical signs are usually very short-lived. A sudden increase in flock mortality. Early mortality is often related to concurrent coccidiosis. So it goes together with coccidiosis. It hides behind coccidiosis with the Eimeria cycling, post-mortem examination, and this is what you are going to see. This is the only post-mortem lesion you are going to see when you have necrotic enteritis. Can you appreciate that thickening of that intestine? Do you think there is anything else that will happen in that intestine in terms of reabsorption? Because we really need to be able to accept and understand the concept around absorption of food. There is no absorption that is going to take place there. And that is what will lead to death of the bird. This BIOCOX to use is very easy. The dosage is actually 1-to-1, and we are encouraging you to talk to your farmers about it. It can prevent and also treat. And we want to use it in the prevention sector. Because we know any person keeping broiler birds have a very high chance of ending up with coccidiosis and necrotic enteritis. And we want them to use it even before the disease happens and even after the disease occurs, so that we can be able first to prevent the necrotic enteritis and secondly to treat the coccidiosis. And I think by doing that you will improve the weight gain, the feed conversion, and the livability of the bird. We had a supplementation program earlier. I think we We have updated it. I know most of you have been using it for your farms, and we have always said do the Vigorex, Vigochic, Vigostart. Now we're introducing the BIOCOX in week 2 as a preventive measure of coccidiosis. And we are saying this product can stay, these phytochemicals can stay within the body for up to 2 weeks, and that is why we are giving it in the 2nd week, and we are saying in the 4th week, you can also include BIOCOX in that schedule. We have also introduced a new gut acidifier known as Nutricid. I don't know how many of you have seen it. I know we have a lot of acidifiers, gut acidifier and water acidifier. What is happening around them is that there is a lot of innovation and realization that the pathogenic bacteria will always proliferate in an environment around neutral pH to any pH above 7%. 7.0. And if the pathogenic bacteria is going to grow and proliferate anywhere from 6.5 to anywhere above neutral pH, alkaline pH, then the best we can do is ensure the environment of the chicken, the digestive system of the chicken, we keep it in a pH below 4. You see what we have done there? So instead of waiting for the proliferation of the bacteria so that we keep using antibiotics to kill it, what if we study the environment where it thrives in? And it has been realized that pathogenic bacteria, E. coli, staph, strep, will proliferate and grow in a very high pH, alkaline pH. So what the acidifiers are doing is keeping the GIT and the environment of the chicken below 4 pH. And if you keep it below, the good bacteria will be able to grow, and the GIT integrity will be maintained, and the birds will be able to absorb more feed, leading to what? More weight gain, and leading to more eggs. As I've said, it's more preventive medicine and less curative medicine. And I can guarantee you, if we keep incorporating all these new innovations, we can actually be able to help the farmer have less withdrawal periods, have less residue of antibiotics in our food, and ensure that we are also healthy. So we are having a lot of residual drugs coming from the eggs and from the chicken. And that is what is affecting the human beings. And the only way we can help ourselves is by helping the chicken and by helping the cows. So I think up to that point, I think I want to stop on that in terms of coccidiosis, and I hope we have learned something new. Maybe we can have a few questions on coccidiosis if there is any, and also the control. Any question?
You said that the coccidia is resistant to most disinfectants. Maybe we get a product from our plant facility, you can use it for disinfecting the banners.
Yes?
Just ask whether you have a product from
for disinfection.
Disinfection. And you say that they are resistant to most
disinfectants. Yes, we do have many disinfectants from many companies, but of course I have to be biased to Atlantis. We do have BioSec, and we do have Philosoph. But I know there are other disinfectants from other people. What I can talk about the BioSec, the importance of BioSec is the innovation that, what did we use during COVID? Yeah? What did we use during COVID to kill the coronavirus so that we can eat and interact? Yeah? Sanitizer. Hapana, situmia scientific names. What is in the sanitizer? Sanitizer ni jina ya mtaa. What is sanitizer?
Most of the things are alcohol.
Yeah? Either no. Hata ndio umeenda zaidi. Okay, my point being that most of the disinfectants that have come in after the COVID, they have incorporated sanitizer in their disinfection. Like BioSec, you'll realize that this is not just a QAC plus glutaraldehydes. There is QAC, which is quaternary ammonium compound, plus glutaraldehyde, which works very well and has always worked very well. So with the new realization that sanitizer, or rather isopropanol alcohol, works faster and kills more germs, we have been able to incorporate isopropanol alcohol into BioSec, and this makes it more effective in a very short period of time. And that's why you'll realize that we keep saying it works faster in a short period of time. So that is one of the products that I can guarantee you it is going to be able to kill the oocyst eggs.
Thank you. Okay.
Yes.
On the same line, okay, I have a farmer who's anaika kuku zake kwa cages, anatumia hii pipe. Anatumia biosec to disinfect your pipes.
A very good question, because we do not want the birds to drink so much of the quaternary ammonium compounds plus glutaraldehyde. What we have is something better, and that something better is the acidic nutricid. These are organic acids. This is propionic acid, this is butyric acid, this is papainate acid. These are organic acids. When you use this, they will be able to kill all the bacteria within the drainage system. They will remove the films, and actually the birds will drink very clean water. So instead of using that, you can use the nutricid, which is new. Nutricid just stands for organic acids. Organic acid is what we want to consume more to ensure the environment is acidic. The germs that are there need to thrive in an alkaline state. So if you flush those automatic drinkers with nutricid, you will actually be able to kill all the germs in there.
Thank you.
Yes, and the ratio is 0.5 ml to 1 liter, making it very economical.
So, okay, another question on rodents. Okay, you've talked about rodent. Can rodent be used to kill these big rats, like the panyamukus?
Again, a very good question, but the ideology will be behind how many kgs will kill, or how many grams will be able to kill. One, because of the service area. What I know is it can kill. What I don't know is the quantity you need to give it to be able to die. Because the only research we have been able to do is around a rat, which is less than 10 grams. And that is why we are able to say, if you reduce rodent 10 grams, you are able to kill this number of rats. So I will not have a number in terms of how many kgs you might need to give it. So maybe it's something we can research on and get back to you as another use for rodent. Because they are all rats, but the size is different. And that service area difference has to be researched to know exactly the quantity they need to feed on to kill it. Remember, it's a slow release, and it kills after 5 days. So if you give it very little, it might take too long. So we have not researched on that. Yes. Any other query?
You said about the spondylosis kwa intestines whereby those coccidio whatever zinaandikwa hiyo endothelium. You said zinaleta ulcer. Do you have anything kwa Atlantis ile dawa yenye inasaidia for quick healing of the ulceration of the intestines?
Si tumeshasema hiyo. This BIOCOX, this vitamin A in here, this MOS and FOS, the whole purpose of those three is to be able to heal that ulcer very fast and ensure there is regeneration of the ulcer, so that now we can have villi forming back again in the chicken, so that we are back to the intestines doing their work of absorption. So if you use the BIOCOX, you will actually be helping in the regeneration. When you look at the indication, the last one is actually repair and maintenance of specifically damaged epithelial cells. Yes. Any other question? Okay, I think we are all home and dry. Maybe I will ask the moderator. Any questions online, Kimaru? I think you asked for a few minutes to speak. So ndio nimemaliza mapema kidogo. So wacha mimi nimalize, alafu muite yaongee for the remaining 30 minutes. I have 20 minutes or so.
Yes, so that now, mimi nisikuje in, you have shared your minute.
Yes, nimeelewa. Sawa. Okay, I think we don't have any more questions online. Thank you so much. I can let you know that all these products are available in your dealing agrovets. You can also have my number. You can have the number of our rep at the back there. You can interact with them there. We have much more where that is, and we can talk more about how we can help the farmer going forward. So let me invite one of us to come and say something, and then we can close the session. There is still a few minutes remaining, so I will invite Mutinda to come and talk to us. Asanteni sana, munipigie makofi. Mimi najitishiaga. Asante.